Impending hydrological changes in Wisconsin due to climate change, combined with vulnerabilities due to failing infrastructure, pose a public health threat, with increasingly extreme precipitation and leaky pipes promoting waterborne diseases that hit children hardest. We expect a warmer Wisconsin with less snow, more rain, and more intense storms. More stormwater means higher disease risk and healthcare costs. "42 degrees. Alright. A wetter Wisconsin will tax our already ailing underground infrastructure. Stormwater transports pathogens. Recent studies reveal significant associations between rain and children's diarrhea. The viruses come from human fecal contamination. Researchers have found the viruses that cause diarrhea in surface water, groundwater, and even the tap water of communities that do not disinfect their drinking water. An inventory of sewer and water infrastructure vulnerabilities should help prioritize capital improvements and alert communities to local health risks. To adapt to a changing climate, we must revise our assessments of the risk of rain-related disease.